Good morning, Dr. Anthony, and thank you for joining us this morning for another COVID-19 update. Minister, with $6.8 billion being allocated for the national COVID-19 response, can you say how this money will be spent apart from vaccination?
This year, we were expecting that we would be able to have access to vaccines for children between 11 to 5. And our understanding is that Pfizer, in the first quarter of this year, would also be submitting their information to the US FDA for a vaccine, which might be a 3-dose regimen for children between 5 to 6 months. So if those vaccines become available this year, then obviously we would like to have access to those vaccines, and we have set aside some resources to do that. In addition to purchasing of vaccines, we normally would have to do some outreaches. You know that we were doing a lot of those drive-throughs and so forth so that people can have easy access to come and get vaccinated. So we'll continue to do some of those this year, and to make sure that we expand our cold chain so that we can store vaccines appropriately and properly. In addition to vaccines, this year we'll continue the procurement of medications that can be used to treat patients with COVID-19. So these medications sometimes can be very costly, so we have set aside enough monies to be able to acquire these medications. When we look at the interior areas, Region 1, we are just at 664, Region 8, 221, Region 7, 338, and Region 10, 348. So of the interior regions, Region 9 is doing fairly well, but this is also relatively low because these numbers need to go up, quite a lot, because our booster doses, we really need people to come out and get their booster doses. The interior, however, presents a different challenge, and that is, while we can have a fixed site, there are several fixed sites. A lot of the population would still not have access, and that's why we have mobile teams that have been going into the villages and doing the vaccination. So we haven't stopped doing that. That has continued, and we'll see more of this happening this year as well. In terms of adults, we have first dose 422,165 persons who receive a first dose vaccine. That's about 82.3% of our adult population. In terms of second dose vaccination, we are now at 310,938 persons. That's about 60.6% of our adult population. And then for the persons between 12 to 17, we have first dose 32,435, or 44.5% of that age cohort, and 22,799, or 31.3% of that age cohort. We know from before that women who are pregnant, if they're not vaccinated, they're more at risk for getting infected with COVID. And we have been appealing to women to take the vaccines. We have seen a lot of them not wanting to take the vaccines because of misinformation, but we have worked with the obstetricians to make sure that people understand the importance of getting vaccinated.
You have been watching the COVID-19 update for today, January 27, 2022. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. I am Shania Gonzalez.